All right. Other characteristics I'd like to see. This is a wish list. This doesn't necessarily mean it's practical, but this is the ideal. And so you have something to shoot for. A non-antigenic, of course. You don't want an allergic reaction, a host versus graft type reaction where it's rejected. And that can happen if you're using body coverage from other folks. Moldable, flowable. Sorry, here we go. So I can inject it possibly, and there's other applications with that injection too, perhaps someday in attendance, perhaps just percutaneous injections in the joints themselves to get coverage to come back. Does not wash out with irrigation during surgery. It can be combined with other scaffolds, for instance. It works as a void filler and does not degrade on the back table rapidly. Reusable, load-bearing, and compatible with internal and external fixation. All right, avoids donor site morbidity, kind of touched upon that a little bit, provides strength if possible. Predictable, controllable results. There's something that happens with BMP, for instance, which is a kind of a competitor type material, whereby you get rapid formation of adventitial bone. In other words, you get bone where you don't want it, and that's not a good thing. You have to go back in and remove it. And then the quality of bone has high osteoclastic activity, which means it's very weak bone, and it's not a good supplement. The product itself needs to accelerate or enhance healing and can be used repeatedly if possible in the same patient. Non-teratogenic, which means it doesn't cause birth defects. All right, future stem cell considerations. Any major organ system within the foot. Let's face it, if you deal with the foot, I'm dealing with pretty much these organ systems right there. I've got to be a dermatologist, a vascular specialist, a neurologist, and I've got to be an orthopedic surgeon as well. So all those systems can have failure, all of them have an application for stem cells. If you've got skin loss and trauma or burns, for instance, venous stasis ulcers, neurotrophic ulcers, as we see primarily in diabetes, for instance, and other such things. And angiogenesis means the regeneration of blood vessels, and stem cells can do that. In the ischemic foot, you've got gangrene and such. Other things, regeneration of nerve and nerve tissue, some conditions there. Regeneration of muscle, perhaps not so much in the foot, but more in the leg, post-compartment syndrome, or other type of problems with that. Bone regeneration, I know that you're pretty much all familiar with that. Drug replacement, hyaline cartilage replacement for defects, and regeneration of tendons and ruptures. Ligamentous reconstructions, they could be helpful there. Fat pad augmentation. Now, all of you are very young in this room, but a certain element of the population that I treat, the elderly, and they have a real problem with, you'd think that, we all are weight conscious, we want to lose, shed pounds, but what happens is human nature is that we gain weight where we don't need it, and it goes away where we do need it. And where you do need it is on the bottom of your foot. If you could imagine if you had no fat pad, it's a very specialized fat pad. It's a type of fat pad that is a shock absorber, so that when you walk, it's not painful, it's not bone on skin. All that goes away is going to be. You can go away with trauma, or even if you get in the hands of a person who injects you too many times with cortisone, next thing you know, you've got a painful condition that lasts the rest of your life. And so this is a real application for adipose-derived mesenchymal stem cells, I think. Obviously, any major organ system in the foot. These are cells that are, this is slides actually from the osteocell lecture. I know that you're all familiar, are you all familiar with this? Am I making too many assumptions here? Okay, no one said anything. Eyes are open. All right, okay, so we can look at this. Let's see. And of course, this is the real true test. Is it really a mesenchymal stem cell that you've harvested, or a trilinear test? Does it develop into bone? Does it develop into cartilage? Does it develop into fat? If you can do that, obviously it is. We don't want the hematopoietic cells because those are the ones going to create an adjuvant response, graft versus host. That's going to be failure. This is a particular case, and I want to just make a little disclaimer, it's not my case. It just happened to be in a set of slides. I have my own cases I wish to show you, but it illustrates something. This is a really terrible thing that's happened to this individual. It's something called Charcot-Marie-Tooth disease, and I don't know if you know this, but this is an inherited, hereditary, if you will, neurological disorder, which is slowly progressive. It can be more rapidly progressive in certain individuals, and results in wasting of muscle, deformity of the foot and leg, weakness and paralysis. And this individual had to undergo a particular, what's called a calcaneal talar tibial fusion. Basically, you're fusing the heel and the ankle bone to the leg bone, right? And apparently it was first done with screw fixation, and they did do an autologous graft and AGF, and the result was pseudoarthrosis, which is a big word that means it didn't heal. It formed a faulty joint, but it didn't go on to fuse. Second surgery, pseudoarthrosis, this time they used a nail, allograft, this time calcium phosphate, and bone marrow aspirate. Result, failure. Third surgery, repair pseudoarthrosis, remove the nail and reinsert. This time they used a competitor product called Symphony Augmentation, which is, again, a form of neuroaspirate, trying to concentrate it, and an autogenous graft. And the result was failure, and the result was, what they recommended is amputation. The fourth surgery, however, used Trinity or substitute osteosome because it's really the same thing, and they reinserted the nail, and the result was it fused, the ulcers healed, asymptomatic, and there's the result. As a surgeon, you take a look at something like this is a nightmare. You don't want to see something like this happen to you and to your patient afterwards. And this person is going to go on to a below-knee amputation. Here they are. It's not the prettiest thing in the world, but guess what? The leg and the foot are still attached, and the person can still walk on it, and it fused and it's pain-free and it's functional. And so that's what stem cells can do for this particular individual.